Welcome to Adjusted Reality, a podcast series trusted by the adjusted and brought to you by the Foundation for Chiropractic Progress, where we learn from athletes, celebrities, influencers, and healthcare professionals about how to optimize health in a fun, relatable way. Join me, Dr. Sherry McAllister, as I speak with Dr. Anna Lembke about her latest book, Dopamine Nation, Finding Balance in the Age of Indulgence, the relationship between pain and pleasure, and how to manage compulsive overconsumption in a world riddled with digital dopamine. Welcome aboard, Dr. Anna. How are you today?
I'm good. Thank you for having me again.
It's fantastic to have you. And our last podcast with you was an exciting hit. So we're delighted to hear more about what your latest book is about. Now, I'm going to start off with asking you, why did you write Dopamine Nation?
Yeah. I wrote it because I think we're living in an exceptionally difficult time in human history in ways that are not immediately transparent. And I feel like thanks to my patients, in large part, I've cracked the code a little bit on maybe how to mitigate suffering in this crazy mixed up world. And I wanted to share that with other people.
Absolutely wonderful, because as a physician myself, we do learn a lot from our patients. And I think we have to give them credit where credit is due. All of those out there that are listening to this podcast, thank you for helping us be better healthcare providers as we listen to you and what you're going through. Well, tell us the title of your book, Dopamine. The audience here is looking forward to learning more about what actually is dopamine and how does our body use this powerful chemical?
So dopamine is a neurotransmitter in the brain that is associated with the experience of pleasure, motivation, and reward. It's probably even more important to motivation than it is to pleasure itself. So for example, in a famous experiment, mice were engineered to not have any dopamine at all, no dopamine transmission, no dopamine receptors. And what the scientists discovered was that if they took food and put it in the mouse's mouth, the mouse would eat the food and seem to get pleasure from it. But if they put the food even just a body length away, the mouse would not get up to go get the food and would ultimately starve to death.
Oh.
So the reason that that's interesting is because what it says is there's something about dopamine in particular that's key for motivation, for getting us up off the couch and getting us to do the things that our brain tells us we need to do to survive in the world. And of course, we've been engineered over millions of years of evolution to release dopamine in response to food, clothing, shelter, finding a mate. The problem is that we now have an almost infinite supply of highly rewarding drugs and behaviors that ultimately trick our brain into thinking that they're necessary for survival when they're really not. And so we can get into this vicious cycle of compulsive overconsumption or even, more severe forms of addiction as our brain essentially gets hijacked and confused by the high dopamine rewards that we're all being exposed to every day.
In your book, which I loved, by the way, you gave an example of the pitcher and the catcher. Right. And I really loved that. And I think it helps to kind of get an idea of how the brain works. Could you just share a little bit about that example?
Sure. So, we often toss around this word neurotransmitter, and the question is, well, what actually is neurotransmitter? It's a chemical that essentially allows neurons to communicate with each other. So neurons are these long spindly cells in the brain that transmit electrical signals to each other to make these circuits that are essentially our thoughts and emotions and everything else that's going on in the brain. But these neurons don't touch end to end. They're separated by a little gap, and that space is called the synapse. And it's there for a very good reason. It's a way to sort of short circuit an electrical circuit that's maybe gone out of control. It's an additional level of checks and balances. And the way then that a presynaptic neuron transmits an electrical signal to a postsynaptic neuron is through these chemical messengers called neurotransmitters. And dopamine is one of those. Others are serotonin, norepinephrine. Those are all neurotransmitters. And the pitcher and the catcher analogy is that the presynaptic neuron is like the pitcher. It gets the electrical signal. It then throws the ball to the catcher. The catcher is the receptor on the postsynaptic neuron, catches that ball, the neurotransmitter. And then once the neurotransmitter binds to the catcher's mitt or the receptor on the postsynaptic neuron, it then sends a cascade of chemical signals that further transmit that electrical signal, through the brain. And that's how we get these loops.
What I really like about that is it's very simplistic, and you bring about, I know Albert Einstein had a very famous quote, something along the lines of, if you can't explain it simply, you just don't get it yet.
Yes,
so I think you definitely get what's really going on here. And
let me just add to that. One of my favorite episodes of The Office is where Michael says, explain it to me like I'm an 8-year-old. And then the guy explains it and he says, wait, explain it to me like I'm a 5-year-old. Explain it to me like I'm a 5-year-old. Anyway, I can really identify with Michael in The Office.
I totally agree with you. Sometimes we just need to dumb it down enough so that it does make a simplistic and easy understanding, so that when we get into these very difficult conversations, you can think about who's pitching and what are they pitching? What's that baseball look like? And as we kind of get into that, we know from your first book, Drug Dealer MD, we have a magnificent opioid epidemic that's happening among us. And opiates are in fact that baseball. So what I want you to go into is the relationship that happens between pain and pleasure. And as most of the non-pharmacological healthcare providers, specifically chiropractic, is the area of focus that this podcast really does resonate around, is we do get the pain and pleasure idea, because it resonates for the body. What the body is doing, the brain will react to, and vice versa. So share with us that relationship.
Well, as I talk about in the book, one of the most interesting findings in neuroscience in the past 75 years is that pain and pleasure are co-located in the brain. And what that means is that the same parts of the brain that process pleasure also process pain. And importantly, they work like a balance. And the way that balance achieves what we call homeostasis, or maintains a level balance, which is what it wants to do. It doesn't want to be for very long tip to the side of pleasure or the side of pain, is that whenever we experience a highly rewarding or pleasurable stimulus, and we get a little tip to the pleasure side and we get dopamine released in our brain's reward pathway, the brain will immediately compensate for that by tipping the balance an equal and opposite amount to the side of pain before restoring a level balance or homeostasis. What that tells us essentially is that for every pleasure, there's a cost. On the heels of pleasure, there is pain. And it can be very subtle. So for example, if I eat a piece of chocolate, that tipping to the side of pain before restoring homeostasis might just be that moment, that fleeting moment of wanting a second piece of chocolate. If I wait long enough, it goes away and balance is restored. But the more addictive a substance is, the harder and faster that pleasure balance, it tips to the side of pleasure, the more dopamine I get released in the reward pathway. And that means that the come down or the after effect is equally intense and strong. That's the hangover, that's the withdrawal. When it comes to opioids, that's opioid withdrawal, which can be extraordinarily painful. But another really important rule governing this balance is that with repeated exposure to the same or similar stimulus, the initial response of pleasure gets weaker, so the balance tips less, and it gets shorter in duration. And the after response of pain gets longer and gets stronger. So this is one of the great paradoxes of how the brain works. The first time we do something, we might hardly notice the sort of after effect of pain that comes on its heels. But if we do that pleasurable thing again and again, we essentially ultimately reset our brain to the side of pain. I talked about these little gremlins hopping on the pain side of the balance. And the more pleasure we indulge in, the more gremlins that we get on the pain side of the balance to compensate. And if we do that over weeks to months to years, we can essentially reset our pleasure pain pathways so that they're tilted to the side of pain. And that is what causes opioid tolerance. That is what causes dependence and withdrawal. That is what causes opioid-induced hyperalgesia. That all of these opioids that we're trying, to use for whatever the reason, on the pleasure side of the balance, ultimately change our brain over time so that we're downregulating our own dopamine receptors, we're downregulating our own endogenous opioid production, and we end up with a pleasure pain balance tilted to the side of pain. And that's the really pernicious aspect of using opioids, especially long-term for chronic pain. Short-term use is evidence-based and there's no problem, as long as the person tolerates it. Not everybody does, but it's the chronic use that, resets or essentially changes our brain. Sometimes people will ask, is there a difference between somebody who doesn't start out with a level balance, like somebody who starts out with pain, right? So their balance is already tipped to the side of pain. And the answer to that is, unfortunately, there's no difference. The homeostatic mechanisms still work the same. So if you start out in pain, you take an opioid, you'll definitely initially get relief from that, but over time, you will essentially still accumulate those neuroadaptation gremlins on the pain side of the balance, but you'll go even harder, even further on the pain side than you did originally.
It's an excellent analogy. I really enjoy how you've set the tone for we are in balance. That's our whole purpose, is to find that balance. And when you go too far left or too far right, AKA you have too much pleasure. It reminds me of you have a birthday party and all of a sudden, it's 2-year-old toddlers and they're throwing cake everywhere. There's too much pleasure happening here. Someone's going to end up cleaning up this disastrous mess. Yeah. I think it's important though, that our listeners get an understanding of that a body in homeostasis is a body that is developing and keeping the momentum of what we're actually looking to be in an existence of peace and prosperity. Because you when you're too far one side or the other, I think that's where it becomes very difficult to come out. And you talked a little bit about managing compulsive overconsumption in your book. Share with our listeners that compulsive overconsumption that you were talking about.
Well, what I basically hypothesize in the book is that we've all become vulnerable to the problem of compulsive overconsumption or addiction because we live in this drugified world where we have almost infinite access to these highly reinforcing drugs and behaviors. So not even just drugs, but things that we do on our phones, on our computers, video games, shopping, gambling. It's all become so much more potent, accessible. Novelty is a huge trigger for dopamine. So, once we find something that we like on YouTube or on social media, the AI algorithms remember it and then proffer something that's quite a bit like that, but just a little bit novel. And that's, that causes that release of dopamine. And then we want to go check it out. So, the hypothesis of the book is essentially that, we're living in a very difficult and unprecedented time in human history because we're just being bombarded by dopamine. And so we're all de facto out of balance, are, at war with our neuroadaptation gremlins, trying to restore homeostasis, but having difficulty doing so. And so ultimately settling out here in the side of pain, when we're not using. And that's really what addiction is. Why do people who have severe addiction relapse even after they stop using and their lives get better? The reason is because they're walking around with a balance tilted to the side of pain, right? They're experiencing the universal symptoms of withdrawal from any addictive substance: anxiety, irritability, insomnia, dysphoria, intrusive thoughts of wanting to use. And I think we've all gotten to that point, whether, your only drug is your smartphone, but, you put it down and you just have these intrusive thoughts of wanting to check it. Did I get a text? Is something good coming my way? I really think, that is compulsive overconsumption and addiction. That's our dopamine out of balance. And, and I have lots of suggestions in the book for how to try to bring it in balance again.
It is. There's a lot of really good stuff that does help you start to think about how to balance those scales again. And when you dive into the understanding, I think first and foremost, you have to understand it, because we walk around, many of us, with no concept of the pain pleasure balance.
Right.
And without fully appreciating that, as we walk into a healthcare provider's room and start talking to them about their current pain, because most will never come and say, hey, I've got this much pleasure, I want you to listen to it.
Right.
That never happens. And if it does, Dr. Anna, I think you and I will both be delighted. It'll be very interesting. But one of the key things is most come with some type of experience that brings them in because it's a painful moment in their life.
That's
Whether
right.
for me, it's someone that injured their low back. For you, it's someone that is on the brink of losing their job because of their current addiction. We do relate to that painful moment where we have to start pulling ourselves up. And one of those pieces that we create is understanding first. And you did a marvelous job of using the acronym dopamine. And I think that each piece of dopamine, while we can't give away the entire store today in our short podcast, would you kind of run through the bits and pieces of dopamine that will kind of give that understanding, that secret to finding the balance in today's age of indulgence?
Yeah, I'm happy to do that. So it's an acronym. So each letter in the word dopamine stands for a framework for how to approach these kinds of problems, either in our own lives or with our patients. The D stands for data. So what I like to do is just sort of objectively gather information about what the person is consuming: drugs, shopping, video games, and a sense of how much and how often, and do it kind of in a matter-of-fact way. Often doing this with patients can be an intervention in itself, because what can happen with compulsive overconsumption or addiction is that we can end up with a kind of a split brain where we're doing it, but we're not really aware that we're doing it, or we're not acknowledging that we're doing it. This is often referred to as denial in addiction medicine. And one of my patients said that denial is an acronym for don't even know I am lying, which I think is great.
I love it.
Yeah. But what happens when we ask our patients this and then they articulate, well, yeah, yesterday I did this and the day before I did that, they're surprised themselves, right? So that can be an intervention of them. They go, oh, wow, when I say it out loud, I didn't realize how much it really was. So that's the first thing. The O of dopamine stands for objective. So then, what we try to do is really put ourselves in our patient's head and figure out, why are you using this substance or this behavior? Why do you spend 3 hours a day looking at pornography and masturbating? Like, what does it do for you? And people will report, a wide variety, but a pretty consistent list of, it's my escape, it's my reward. It helps me stop thinking about myself. I think we all kind of crave that non-being where we're not constantly being tortured by our relentless thoughts. The brain is so interesting to me because it really is like a beating heart. It has ceaseless thoughts,
right?
And it can, it's exhausting. So some people use it for fun, right? For pleasure. Then the P of the dopamine acronym stands for problems. So then I ask patients to say, okay, well, I've heard all the good things. What about this is not working out for you anymore? One of the common things patients will say is, well, it's not working anymore. So it's not working out because it's literally not working. Cannabis used to relieve my anxiety and help my pain, and now it's not doing that. Or, opioids were really effective for my pain at first, and now I'm in as much or more pain as I was before. And so that's really helpful because that can be a hook to know where their motivation is. For a patient with pain, if their motivation is to have less pain, then it's really important to explain the pleasure-pain balance, opioid-induced hyperalgesia, and how paradoxically getting off the opioids may actually be the thing to help to help their pain. And then the A of the dopamine acronym stands for abstinence. And this is where I ask patients to abstain from their drug of choice for 30 days. Why 30 days? Because 30 days is the minimum amount of time it usually takes for those gremlins to hop off the pain side of the balance and for homeostasis to be restored. That is to say, for our own bodies to regenerate dopamine receptors, our own opioids, our own serotonin, to kind of bring it all back up to level again. It's really important if you're asking patients to do this dopamine fast, that number one, you've ruled out that they're not going to have a life-threatening withdrawal. So people can have life-threatening withdrawal from opioids, from benzodiazepines, from alcohol. So you want to make sure that you're not dealing with somebody who maybe needs to be hospitalized or needs a medically monitored detoxification or a slow taper. But if you can rule that category out, then whether the problem is pornography or shopping or cannabis or opioids, you ask them for this 30-day fast and you warn them that it's going to get worse before it gets better. Why? Because right now they're barely maintaining homeostasis with a bunch of gremlins on the pain side and a bunch of their drug of choice on the pleasure side. The moment they take this away, there's going to be no weight on that side of the balance, but the gremlins like it. They stay on there for a while. So they're going to experience those universal symptoms of withdrawal. But if they can just wait long enough, and typically the first 2 weeks are critical, the gremlins start to hop off and balance is restored. And by the time people get to weeks 3 and 4, many of them come in endorsing, feeling better than they have in years. And here's the key. If they aren't able to abstain, even when they plan to, that's helpful information because it says maybe it's not within their willful control. If they abstain for the 4 weeks and they come back and they don't feel better, that's helpful information because it says, hey, there's an underlying psychiatric or emotional condition. It's not just about this drug or even primarily about this drug. So the abstinence fast is really key. And then just quickly, the rest of the acronym, M stands for mindfulness, I stands for insight, N stands for next steps. That's when patients come back, you do the pros and cons. You say, okay, do you want to continue to abstain or do you want to try to use in moderation? They almost all want to go back to using in moderation. All right, what barriers are you going to put in place to help you with moderation? And then the E of dopamine stands for experiment. You send them back out in the world. They try whatever they were going to try, and you have them back in another month and you talk about how it went.
That was an amazing overview of dopamine in and of itself. And I think you are changing the nation by opening up and having honest conversations, especially about the balance in the human condition that we're in right now, and the amount of stress that can come either from being in a painful situation or just being in a pandemic with a mental health crisis based on a lot of what we're experiencing. So on behalf of all of our listeners, I want to thank you for being transparent, for bringing an honest conversation forward, and to allowing us an inside and very honest approach to looking at ourselves and not be in denial. And I will always remember that acronym now, to where we want to go and how do we want to restore that balance. I want to thank you so much today, Dr. Lembke. I know you're extremely busy and you took the wonderful time to spend with us today. And I look forward to our listeners getting a hold of your Dopamine Nation and learning more about themselves. So thank you for joining us today.
Well, thank you. It was my pleasure. It's always a pleasure. Thank you for your work.
I want to thank you for tuning in to Adjusted Reality as we spoke to Dr. Anna Lembke about finding balance in an age of indulgence, how to manage compulsive consumption, and a sneak peek into her latest book, Dopamine Nation. She shared some powerful acronyms, one I won't forget, like denial and dopamine, to help us look deeper into our current balance of pleasure and pain, and steps to work towards to keep it a balanced scale. This podcast was brought to you by the Foundation for Chiropractic Progress. As a special gift for listening today, visit f4cp.org/health to get a copy of our Mind, Body, Spirit ebook, which focuses on many ways to optimize your health and the ones you love without the use of drugs or surgery. Don't forget to subscribe, share the podcast with friends and family, rate and review. I look forward to having you join me again for our next episode for Adjusted Reality. Till then, be well.